Okay, old business. Compass Health. Dr. Deb Frost is going to present an update on Compass Health in our schools.
As she makes her way up, as a way of introduction, last year we started this program for the mental health side of our student safety programming, and she presented a unique opportunity, and principals have been very good to report back to us, so I thought it'd be good for you to hear an update and listen to how she thinks things are going and what the vision for the future would be. Welcome.
Thank you. That was very kind. It's easier to build strong children than to repair broken men. Quote by Frederick Douglass, abolitionist and statesman. I'd like to thank the board this evening, the school principals, the guidance counselors, and the teachers of the Rolla Public School District for doing just that, working on building strong children in partnership with Compass Health. We are grateful for the opportunity. I'd like to present you with a little data today, and I'm open to taking any questions that you may have on the program. It's a sad statistic in our society that we currently have a mass shooting every other week. Opioid use is at a crisis level never seen before, and suicide has surpassed motor vehicle accidents as the leading cause of death in teenagers. Last year there were 34,000 motor vehicle accidents and 44,000 deaths by suicide. If you don't pay attention to those numbers, your community will pay the price. We're excited to say that the Rolla Schools has opened their doors to us. This year, we currently have 4 school-based therapists in the system and 2 psychology doctoral interns. And we have 2 positions posted for additional team members. Last year was our first year, as Dr. Dallas shared, and we were excited. Really, I would say the program, in fairness, ran October through May because there was a little bit of startup and getting used to and educating the team on how to process the referrals. So in really an 8-month period, we served close to 150 children in the school that would not have received services otherwise of a therapeutic nature. Just as a reminder, this was a program that became available because we now have statute changes to allow us to bill Medicaid in the school, on school property for therapy. So for us, it's a Medicaid program, or we will accept self-pay from parents as well, and we accept all other referrals to our clinic. But the 150 that I speak about were actually served on school property. So we're super excited about that. This year already, and we're in the first quarter of the school year, we already have 75 students enrolled in the program across the Rolla system, with the high school leading the pack. I think that they're an excited team about it, and I think that the high school students often speak up themselves in addition to the teacher referrals and parent referrals. So it kind of makes sense that the older kids would have a higher volume initially because there's just more routes of referral. In our clinics, and the numbers are pretty consistent for the school-based referrals as well. Generalized anxiety disorder is the #1 diagnosis we're seeing in new patients. That's not unexpected given the statistics that I just shared about our culture and what our children are facing every day. Even though it might not be occurring in Rolla, they're seeing it on the news, they're bombarded with it in the newspapers, and probably more importantly on social media. At this time, I'm happy to entertain any questions specifically on the program, how it works. Our plans are to continue to grow the program as the school tolerates us, and just as a reminder, we are also willing to come do any kind of psychoeducational programs for free within the school system to teachers, guidance counselors, or parent groups as needed.
Sarah, I wouldn't want to put you on the spot, but you could probably speak from the school counselor point of view too. But if you want to do that, you have to come to the microphone.
She's not afraid.
While she's on her way up, just a quick question. Do most of the students that come continue to come regularly, or is it a lot of they're in a crisis mode, they need help right now, and it's a one-time thing?
We have more one-time consults, I think, at the high school level. Most of them really do enroll for a standard course of treatment. So whether that be 3 months or 6 months, depending on their presenting problem and treatment issues. So it's not year-long therapy, although last year there were some kids that did stay in, for a longer period of time. But it would just be like in our clinics. It's based on presenting problem.
Right.
But I know Sarah sometimes has some one-and-dones for assessment. Can speak to that. Sorry. Yep.
We've been really excited at the high school to have this opportunity to reach out and get our students help. Sometimes transportation is an issue. I have several students who, their parents just can't get them to appointments outside of the school day, and this has been really helpful for some of those kids, particularly those who don't drive or don't have the gas money, that sort of thing, to be able to get there. It's also been great the way that the counselors from Compass Health have come in and just been a part of our team and been willing to talk through student situations with us and help us get those referrals in so that more students can get seen and get the help that they need. And they do see a lot of what I would consider our high flyer, or our frequent flyers in the counseling center who have the most need, and a lot of times demand the most amount of time as well. So it's super helpful in terms of being able to share the wealth, in terms of being able to help students, not only the ones that are high need, but also freeing us up a little bit to spend time with kids who are less critical in need. So it's been a real asset, and across the district, the counselors have been very pleased with, from when we've talked about it, we've been very pleased with adding that to our programming.
How long are the sessions?
It varies, again, based on the presenting problem. They can be as brief as 15 minutes. That's uncommon, and typically we go up to 50 minutes. But we try to make sure, A, they don't come out of core class time, that it's appropriate to the presenting problem, and we find with the younger children, slightly briefer sessions tend to go better in terms of attention span.
How do they know about this service that's offered in the schools? How do the students know?
So our typical route of referrals is through teacher and guidance counselor, and we have no permission to contact families. So they identify individuals, unless a high schooler might come into the office and self-report, but they identify individuals that they think would benefit, and they contact the family and get permission for us to send a packet of information home. In that packet, it describes the program, and they give us a signature that allows us then to speak with their child. In a more crisis situation, the guidance counselor may call the parent and say, hey, is it okay if your child speaks with someone from Compass Health who's on our team and in the school?
Yeah, it's that student assistance team that each building has, where they just become a part of that team. So when they're talking, I was in one at the high school where you all were doing your cabinet meeting, and everybody was just talking about individual kids, where they were, what they needed, and they were just like the SROs, were just part of that ongoing wellness team. And then we've physically built space for them to be in our building, so they're viewed by everyone eventually as just one of the staff members.
In the beginning, they really try to be part of the milieu and take on even some duties in the initial school year, so kids get used to seeing them in the building and see them as part of the team, even though they're really a Compass Health employee. And then we have a team member at our office that will walk parents through the packet and get the supporting information if the parent feels overwhelmed by. As long as they read it and sign it and give us the permission to call them, we will call them and walk them through the other information we might need to get from them, parent or guardian on the child. So we have a support staff in our facility. Our goal is to have the smallest burden possible on your team, but we do have to ask them to make initial contact because we're not allowed.
And then you do have an office here?
We do have an office in Rolla, yep, and we also have a 16-bed residential unit for adolescents who are experiencing substance use disorders. And we have a 4-bed facility for individuals with chronic mental health and developmental disabilities. So we have 3 programs:
Wonderful.
outpatient, teen residential, and adult disabled programming.
Very good. Thank you.
Do you guys get any referrals from kids that either aren't enrolled in health insurance or insurance that maybe you guys can't bill? And if so, what do you guys do with those?
Yeah. So a student that would have no insurance. So here's the truth. It's rare for a child to be if they are uninsured, typically we can link them to where their best form of insurance would be. If their parents don't have insurance, they typically can get Medicaid. And we have folks who will help them through that process. If a child they have no insurance and their income is too high, we do have a sliding scale fee that goes down to $20. So the self-pay rate, depending on income, can go down to $20 for a session. So again, we receive federal money as well. I heard some of you talking about that earlier. So we do have to collect documentation to prove that we know their income before we offer them a slide, because we have to apply that fairly and consistently. We can't just offer anyone that fee, because it is based on income. But I think it's one of the lowest slides in the area for therapy.
Wonderful.
Do you feel like you've lost students because of the price, or is that usually not an issue?
I don't think so. I mean, I feel like last year we served 150 more students than we had served the year before. And interestingly enough, we have had quite a few referrals for other family members that then have come to the office. So as you know, children live in their family environment, and there are systemic issues at times. So sometimes once we get the child enrolled at school, then we can often see a parent or an older sibling or younger sibling in the office for other services that, again, helps that family culture and benefits everyone.
That's great.
Yeah. So I actually would say we probably have more business than we can almost keep up with.
So the
The
4
comp-
buildings you're in now are,
So Amy Chambers has a office at the junior high and the high school, and she sort of splits her time there evenly. We have a school-based therapist, Sherry James, who goes to Mark Twain and Wyman. And Wyman is the elementary that also has our 2 doctoral level students there, and that is, and they actually, it's sort of a free service to the kids, so Wyman gets to utilize them and has done that for, gosh, probably almost going on 10 years. That's just something that I had worked out with the school principals there to get some great training for the students and get some help to the school system. And so Wyman has Sherry James and 2 interns, and then Truman has Tammy Cox, and the middle school has Megan Harris, who's our newest SBT this year. But they all love their jobs, speak volume of praise for the teams and the space and the generosity and collaborative nature, so it's really been impressive. And I think we're in 40 school systems across the state, and the things I hear at the other school systems, I'm like, that doesn't happen in Rolla, that doesn't happen in Rolla. So I'm getting myself a bad reputation for singing your praises, but.
May get some new employees.
Yeah. So our map is quite large. We are just so you know, Compass Health is the largest community mental health organization in the state. We're actually the 3rd largest in the nation. And we also carry a federal distinction of certified behavioral health clinic. It's an 8-state pilot federal project, and in that project we are the largest in the nation. So we're a small town company that's quite large, and so we're really proud to bring those resources to the communities that we live in and raise our children in. So, can I entertain any other questions?
Sounds great.
Well, I will leave you with this quote: "Alone we can do so little, together we can do so much." Helen Keller.
Thank
Thank you.
you.